Glute bridges are brilliant for both rehab as well as general strength training. And the nice bit is you do not need any fancy equipment for them. So in this video, I'm going to demonstrate 4 types of glute bridges, how you can make them harder, how you can make them easier, and why you may want to use the different types. But I'm also going to point out some common mistakes because you can actually injure your neck or your back if you do it in a certain way. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists for sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want a link to our website. What are the benefits of doing a glute bridge exercise? Well, it strengthens multiple muscles at the same time. So you're strengthening your back muscles, your stomach muscles, so that's your core muscles essentially. Your gluteal muscles, but not just glute max, also glute med and glute min. As well as your hamstrings. And you can easily, by adapting it, you can target one area more than the other. So for instance, if you're doing a glute bridge on a single leg, you're going to get a lot more of your oblique muscles in your core kicking in. If you do them with a slightly straighter knee, you activate your hamstrings more and you can actually get a lot more hamstring strength through that. And if you're doing it with pretty straight knees, then you're getting to the point where you actually build a lot of outer hamstring strength. But they're also really good at actively stretching the front of your hips. And a lot of us are getting tight in our hip flexors because we sit so much and your hip is always in that bent position. So coming up in the bridge and straightening your hips out is a brilliant way of actually stretching that and at the same time strengthening the muscles that keep your hips there. So it's a really good all-in-one exercise. I'm often asked how many repetitions of a glute bridge somebody should be doing. Well, it depends on how you're doing it and how fit you are, how used you are to strength training. So let's look at 2 scenarios. You can do a glute bridge either as isometrics, where you hold the contraction for several seconds, or you can do them as isotonics, where you continuously move in and out of the bridge position. If we're looking at isometrics first, if you're new to it, you usually start with short holds, so 10-second holds, and you build up to about 30-second holds. Now, if you're doing the short holds, the 10 seconds, you do more repetitions and you have to rest at least for the same amount as you hold it for. So you'll hold it for 10 seconds, come down, rest for 10 seconds, do about 10 repetitions. Find that easy, then you start increasing the hold time as well as the rest time, but you decrease the number of repetitions. So for instance, you want to work up to being able to hold it for 30 seconds, rest 30 seconds, do about 4 or 5 repetitions. Now, if you're not tired after 30 seconds times 5, it means that it's too easy and you likely need to add some weight to it or find a different position to make it more challenging, like double legs to single leg or something like that. Now, if we're talking about the isotonics, where you move in and out of the position, if you're new to strength training, you usually want to build more endurance strength first. So you want to work with a repetition that gets you tired within 12 to 15 repetitions. So higher repetitions and more rest. So you're looking for 12 repetitions, rest for between 1 to 2 minutes, and do about 3 sets. If you're somebody who's used to strength training and you're going for real strength gains, you can use weights or positions that make you tired within 8 to 10 repetitions. But remember, you always need to have good form for all those repetitions. You rest for 1 to 2 minutes and you do between 3 to 5 sets of them. So it all depends on your fitness level. Once you find you can do about 2 or 3 repetitions more than what you usually could, so you're getting stronger, it's time to either increase the weights or make the position more challenging. We're going to start with the standard glute bridge, which is brilliant if you've never done bridges before, you're getting back into it, or you just want to make sure that you get your technique right. Also, you can really easily make it harder work by just simply adding weights to it. So let's look at what this looks like. The first step is we have our heels quite close to your bottom. If you go up and your hamstrings cramp, it means that your hamstrings are working harder than what they want to be working. If you simply bring your heels a little bit closer into your closer to your bum when you do the bridge, your hamstrings won't have to work that hard. Now, let's just quickly look at the different elements. If I just demonstrate one go without telling you what I'm doing, you want to go into that position and come back down. Now, what do I do before I do that? I gently tighten up my tummy muscles, not as strong as I can because that's not how we do sport. It's just a gentle tensing of it all. Then I squeeze my bottom and I'm squeezing my bum to get me up there. So that is where I stop because my hips doesn't want to go further. Often what I see is people use their backs to do it and then they end up there and then they can't understand why their backs are getting sore. So a glute bridge is not the same as the poses in yoga where you want to go all the way up. With a glute bridge, you literally just go, you squeeze your bum, you extend your hips to where your hip stops you, and that's where you stop. And then you hold it there in that position. Now, if your hips aren't going fully straight, it means that you probably want to work on mobility in your hip flexors and do some hip flexor stretches. Also, you don't want to lift up there because now I'm putting the pressure on my neck as well. So if you're getting neck pain or you're getting back pain, this is likely the reason that you're trying to force it too high. Now, if you're lifting and you're just getting to there before it stops you, because I've seen that, it can be that your hips are really tight or you've got arthritis and it simply stops you the joint form. You can see that it's a bit annoying because you're not going very far. Now, something that can be really useful is if you place your feet on a step of some sort. Now, I don't have a step that I can easily move, so I've rolled up a nice thick mat that I'm going to use. What this does is, immediately when I lift up in this position, I have a bigger range of motion that I can use my glutes, my hips through. So actually, this is even better because I'm now strengthening my glutes through a much larger range. And this is often, if you've got an old back injury or you're just finding, even if you just focus on squeezing your bum to get you up there, your back still doesn't like it, placing your feet on something to just lift it up so you've got more range of motion before you get to this point can be really, really useful. And it really doesn't have to be high. The higher you go, the more the hamstrings are going to work. So for this, where we're looking for a glute bridge, we just want a quite shallow step. So of course, refer to the section I did on how many repetitions and things, but you could just hold the position. You could do repetitions going up and down, or you could place weights on it. There's many ways to make it harder. But now I'm going to show you how to then transition that we get a step closer to actually doing it on a single leg. So one of the ways that you can make the double leg glute bridge harder is by going onto one leg. But often people aren't actually strong enough to do that jump immediately. And it's nice to have an intermediate step in between that. And the offset bridge works really well for that. So what do? You go into your normal bridge position, but now you straighten your one leg out slightly. And the idea there is that you are going to put some weight through it, but you're going to put most of your weight through the one that's bent more. So we're going to repeat it with one leg slightly straighter, and then again with the other leg slightly straighter. Another way to do this is that you actually place the other leg on a ball or something that's unstable, that you can't push it that hard through it. But I prefer to just do it like this. So now, exactly the same steps. You tighten up your tummy muscles gently. You're squeezing your core muscles and you're squeezing your bum to get you up there. And I'm feeling this leg is working a lot harder. But now what you want to look out for is you do not want your hips to twist or dip. So let me show you quickly with this. Oh, now I'm getting a cramp in my hamstrings. So let me show you quickly here. This is my leg that's going to do less of the work. This is the one that's going to work harder. I am tightening up my core muscles as well as my pelvic floors. And just squeezing my bum to get me up there. My left leg's doing most of the work and I'm keeping my pelvis nice and level. So if I put a cup of coffee on this, it won't spill. So you don't want to have one hip below the other one. It's got to be there. Now, a little trick that's good to teach you this is if you find that, oh, I am there, don't go back down and correct it. What you do is you go, oh, I'm skew. Can I correct it in this position? Because then immediately you teach yourself how to do that, and then you come down slowly. Again, you can either do it as isometrics, you can either do it as going up and down, add weight to it, whatever you want to do, but you've got to repeat it into both sides. If you're doing this for rehab and you notice that one leg is a lot stronger than the other leg, you may want to work the one leg harder than the other one or go according to what the weakest leg can do, because then the stronger one will just kind of paddle the water and this one will catch up. Okay, so step up from the offset bridge. Once you find that really easy and you can do your repetitions there, we want to start doing marching bridges where you go up and you actually lift one leg up at a time to see that you can keep your control there. So you're in your favorite glute bridge position. You squeeze your bum, squeeze your tummy muscles, squeeze with your bum to get you up there. Now, once you're up there, what you can do is you can also push with your elbows through into the floor. This activates your posterior chain, the muscles on your back, because when we run and walk, your lat from the opposite side works with the glute from that side. So by doing this, you're just helping them all activate and work together. Now, you really make sure that you're squeezing your bum, especially on the side that's going to be supporting it, and you really squeeze your tummy muscles. And now you slowly lift one leg up and check that your hip didn't drop. Okay, so it's got to stay there. And then you place it back down. So before you lift again, make sure you didn't sag down. You squeeze your bum, squeeze your tummy, think about squeezing through there, and slowly lift this one up and put it back down. Now, what you don't want to see is that you do that. Remember, if you do that, correct yourself and put it back down. Now, I get tired when I speak while I do it. If you do cramp up in your hamstrings, just do a passive stretch and just hold it for about 10 to 20 seconds, and then you can go again with it. Otherwise, it'll cramp the whole time. Initially, when you start, you may find if you try to do 10 lifts in a row, you lose your form so badly by the end of it, it's not worth it. So what I tend to tell my patients when they start with this is they only do about one this side, put it down, check that they're correct, tighten everything up, push with the elbows through, lift that one up, and then they come down and rest. And they do their repetitions like that. But eventually, they do want to get to where they're in this position and they could just keep going for all 10 repetitions without actually losing their form. Okay, so finally we get to single leg glute bridges. Now, the big thing to look out for here is that as you lift up, your pelvis must stay level. So think about that you've got a cup of coffee or something on there, and when you lift up, it can't be skewed because then it's gonna spill. So you want to keep your pelvis absolutely level. Now, we do exactly the same as we've done before. So we decide I'm going to use my right leg to start with. So I'm going to lift my left leg off and I'm going to keep it pulled into my tummy. I don't want it to go there because look what happens. If I'm up there and it's into my stomach, my back is naturally in a good position. If it starts drifting there, it's very easy to start overextending your back. So you want to keep your hip into you. If you struggle to do that, get something like a rolled up ball of socks or something that you can actually pinch there, or a tennis ball if you have one, so that you know your hip is staying there. So we start in that position. You start by tightening up your tummy muscles, as always. We're going to push through our elbows to help us a bit, and you're going to squeeze your bum to get you up there. So here we go, and up we go. And I'm stopping when my hip says that's enough, because I don't want to overextend and go onto my neck. So we're stopping there, and then we're coming back down. And up we go. Now, if your hamstrings cramp when you do that, you either check, does it help if I move my feet in a little bit further, a little bit closer? Often it's better to have it closer. But two, it may also mean that actually they're tired and that's why they're cramping. So perhaps you did too much other exercise yesterday or today, or they're simply not strong enough for this yet. And you need to use some of the other positions to first strengthen them up a bit more before you do the single leg one. So let me just show you on the left. What we don't want to see is this leg drifting out, so I'm going to keep it there. I'm going to lift up, and you also don't want to see this hip dropping that you get like that. You want to be in a nice straight line. If you find it's dropped, correct yourself, think about pushing this to the ceiling, and then come back down. Brilliant. Hope you found that useful. Now remember, if you need more help with an injury, you're welcome to consult one of the team via video call. Link to the website is in the description of this video. Take care.